Hello everyone, welcome to my channel Daily Drug Info, and don't forget to subscribe Daily Drug Info to watch new videos. Today I will describe diuretic drug Mannitol. Overview and indications. Mannitol is an osmotic diuretic. It is an effective osmotic diuretic for decreasing intraocular and intracranial pressure. The drug has also been used in treatment and prevention of acute renal failure and for promoting the urinary excretion of toxic substance. Dose in adult: reduction of intracranial pressure and cerebral edema by IV infusion 1.5 to 2 gram per kg. In reduction of intraocular pressure 1.5 to 2 gram per kg over 30 minutes. In glomerular filtration rate measurement, 20 gram 100 ml with 180 ml of normal saline and infused at the rate of 20 ml per minute. Determine urine and blood concentration of mannitol in mg per ml. Pediatric doses 0.25 to 2 gram per kg by IV infusion, repeated as required. Administration: administer mannitol over 30 minutes. Strength available in infusion 20 gram per 100 ml 500 ml infusion. Nursing care: monitor blood pressure, fluid and electrolyte balance, and renal functions. Pregnancy status: C. Use with caution if benefits outweigh risk. Animal studies shown risk and human studies not available or neither animal nor human studies done. Adverse effects are congestive heart failure, hypernatremia, hyponatremia, hyperkalemia, diarrhea, renal failure, pulmonary edema, and allergic reactions. Thank you for watching Daily Drug Info.